You know that feeling, right? You wake up and you feel like you've been run over. And the first question that pops into your head is this just a really bad cold I can power through, or is this something else? Figuring that out is honestly the first most important step.
So to get you totally prepared, here's what we're going to cover. First, what the flu actually is. Then, we'll put it head-to-head with the common cold. We'll look at the risks, talk about your best defenses, and finish up with the really crucial part, when you absolutely have to call a doctor.
All right, let's start with the absolute basics. What exactly are we dealing with when we talk about the flu?
Okay, so first things first. True influenza is a virus, and it specifically goes after your respiratory system. We're talking nose, throat, and deep into your lungs. And this is a super important point. This is not what people call the stomach flu. That's a totally different thing caused by other viruses. The real flu is all about your breathing.
So how do you catch it? Well, it's crazy contagious. It travels in these tiny little droplets when someone who's sick coughs or sneezes or even just talks. You can breathe them in, or you can touch something like a doorknob that has the virus on it and then touch your face. And here's the kicker, you can actually spread the virus for a whole day before you even feel sick.
All right, let's tackle the biggest point of confusion out there. How do you tell the difference between a miserable cold and the full-blown flu? Let's make it crystal clear.
There are two dead giveaways here. First is the onset. A cold kind of creeps up on you, right? A sniffle here, a sore throat there. But the flu, it hits you suddenly. It's like a switch flips. And second is the severity. A cold can make you feel lousy, for sure. But the flu is just on a whole other level of awful. That intense, all-over sickness is the real telltale sign.
And here are those classic signs you're dealing with influenza. This isn't just a runny nose. We're talking a high fever, a nasty cough, a pounding headache, and muscle aches that make your whole body hurt. The fatigue is no joke. It can make it hard to even sit up. And that lovely cycle of being hot and sweaty one minute and having bone-rattling chills the next, yep, that's the flu.
Now, most healthy people will get through it in a week or so. But it's so important to understand that for some people, the flu can be incredibly serious and lead to some pretty major complications.
So who needs to be the most careful? There are specific groups that are at a much higher risk. This includes really little kids and older adults, pregnant people, and anyone who's already dealing with a chronic illness like asthma, heart disease, or diabetes. Also, if you have a weakened immune system or a BMI of 40 or higher, you're in that high-risk category too.
And what kind of complications are we talking about? Well, the flu can sometimes lead to other, more serious infections, and the big one is pneumonia. It can also make existing health problems like asthma suddenly get much, much worse. And in some rare, really dangerous cases, it can cause infections in the heart or even the central nervous system. This is exactly why we can't just brush it off as just the flu. Okay, that was the serious stuff. But here's the good news. The really good news, there are incredibly effective ways to protect yourself. So let's talk about your best line of defense, which is always prevention.
Let me be as clear as I can be about this. The single best, most effective tool we have in our arsenal to prevent the flu is getting that annual flu shot. It is, without a doubt, your #1 defense.
So what does the vaccine actually do for you? Well, for starters, it makes you way less likely to even catch the flu. But just as important, even if you're one of the unlucky few who get sick anyway, having that vaccine in your system makes it much, much less likely that you'll get seriously ill, end up in the hospital, or worse. And on top of the vaccine, think of these habits as your daily armor during flu season. It all starts with washing your hands with soap and water for a solid 20 seconds. Then, try really hard not to touch your face. Cover your coughs and sneezes with your elbow, not your hands. And finally, wipe down those things you touch all the time. Your phone, doorknobs, keyboards.
All right, let's wrap up with what might be the most critical piece of information: knowing when it's time to stop trying to tough it out at home and get immediate medical help. Look, for most of us, getting the flu means a few days on the couch with fluids and rest. You can manage it. But there are some very clear red flags that signal a real medical emergency, and you just can't ignore them.
For adults, here are the big ones. Any trouble breathing or shortness of breath. Any pain or pressure in your chest. If you feel dizzy or confused and it won't go away. Seizures, or just extreme weakness or muscle pain. Any of these mean it's time to get help right away.
Now, for kids, you're looking for all of those same signs, but with a few very important additions.
Watch for really fast breathing, or if their lips or nail beds start to look bluish or gray. If they're crying but not making any tears, that's a sign of dehydration. And pay very close attention to this one. If they seem to be getting better and then suddenly get way worse with a high fever and a bad cough, that is a major red flag.
And really, this quote from the Mayo Clinic just says it all. If you're in one of those high-risk groups we talked about and you think you have the flu, the advice is simple. Don't wait. Call your doctor right away. Getting treatment early can make a huge difference.
So as we wrap this up, it all comes down to one question. Now that you have the facts about the virus, the risks, and the ways to protect yourself, are you prepared for flu season? Thanks so much for watching.